Okay, that's great. Good morning, Dr. Malhotra. It is an
Hi,
honor.
Pranita.
Hi. It is an honor and privilege to welcome you and for this interview. And
Delighted to be here.
Congratulations for your new book, 21 Days to Improve Your 21-Day Immunity Plan. A perfect way to take the first step to transforming your life. And so how do you feel about delivering two breakthrough books in the matter of a couple of years, which totally transform the way medics as well as the community or normal people view healthcare as?
Thanks, Pranita. Yes, I've written, but my first book was a POPI diet, and then this is now the 21-Day Immunity Plan. Really essentially to try and change the culture of medical practice, to inform and empower both doctors, members of the public and patients about how the importance really of lifestyle changes and about how quickly those changes can impact on people's sense of well-being and also their health markers. So it's just one, if you like, one bit of, one sort of medium for me amongst many others to try and get that message out there. So, I'm very indebted to my publishers as well, that with their assistance and help, we managed to edit a book and get it out within about, from about 6 weeks of me writing the 21-Day Immunity Plan. But I think more for the purpose of the fact that there was a sense of urgency given the scale of the COVID-19 pandemic and the people who are adversely affected by it, so that more people could be empowered. However, having said that, I have been, those messages, the clear messages about changing lifestyle, predominantly about how the importance of diet is so impactful on health markers. I've been going on about this even before, we had the peak of cases in the UK, on mainstream media and both broadcast and print. So this is just another tool really so people can have a more in-depth understanding of the science of how poor metabolic health, if you like, which we'll define shortly, also equals poor immune health.
Yeah, and I think what you are saying, Dr. Malhotra, is changing the metabolic health, prevent premature death in any form. And that's the foundation, what you're saying, isn't it?
Yeah, I mean, poor metabolic health really, which is rooted in what we call insulin resistance. But in very simple terms, people who aren't familiar with these terms, these descriptions, is essentially it's excess body fat, which then increases the risk of many conditions, from heart disease to cancer to type 2 diabetes, high blood pressure, even Alzheimer's. So this is really the roots of it all. And that's what I try and, portray or help people understand through the book. But there are also ways of measuring it, indirect ways of measuring whether you have poor metabolic health or whether your metabolic health certainly is suboptimal. Yeah. And we know from data in the United States, for example, that only 1 in 8 people have optimal metabolic health and only 1 in 4 people aged between the ages of 20 and 40, even young people, are affected by this. So it's trying to educate people to be aware and then to give them some, advice and information about how they can improve it. And how that improvement can start very quickly, even within a few weeks of changing one's diet and other lifestyle habits we need to obviously think about, whether it's how much exercise we do, the amount and type of exercise specifically, our stress levels, our sleep. So it's really bringing it all together. But just for people to just understand, and obviously, getting the book, which is I think will be helpful for people to read, because it's not a very long book. I mean, you can get through it probably in a couple of hours, Pranita, as you know.
Yes.
There's a lot of information in there that I think could be very impactful. Is really to think about 5 markers which aren't routinely measured together and certainly not acted upon within, when it comes to going to see a doctor. And those are your average blood glucose levels, your blood pressure. 2 types of, what we call cholesterol particles, triglycerides, which is a fat in the blood, and good cholesterol, HDL. And then waist circumference. So this goes way beyond obesity. Obesity really is only the tip of the diet-related disease iceberg, because many people, especially people from different ethnic groups, certainly South Asians,
South Asian.
they tend to develop conditions related to excess body fat, even normal body mass index, about 43% from data from the States again. So really it's about shifting the paradigm in the understanding of obesity beyond obesity so that we can help many more people who are affected with diet-related disease.
And what you clearly mentioned, and the point I was going to come slightly later in the discussion, was people from BME population. So South Asian, African, where there are exactly what you said, that BMI can be low, but there could be a visceral obesity, abdominal obesity, and that is more
Yes,
harmful, isn't it?
absolutely. So, that is the crucial, the key is that the waist circumference, which is an indirect measure of your visceral fat, your basically fat that develops around your intra-abdominal organs, your pancreas, your liver. That is the harmful, damaging fat that releases what we call inflammatory markers. We call it low-grade chronic inflammation, which over time does damage to health and really leads to many of these conditions, but also causes a dysregulated immune system. And that's why there's a very clear correlation with people who are adversely affected from COVID-19 and these abnormal metabolic health markers related to excess body fat in the abdomen. And that is, more predominant amongst people from BME in terms of normal weight, so-called normal BMI. And the problem with BMI is very crude. So people, it's basically a measurement of your weight in kilograms divided by your height in meters squared. Mm-hmm. And that gives you a number. So traditionally, if you've got a level between 18.5 and 25, your so-called normal BMI. Yeah. 25 to 30 is overweight and over 30 is obese. But this doesn't tell you your muscle mass, your body fat percentage, and it doesn't account for ethnicities and even age. As people get older, you'll get a decline in muscle mass and more visceral fat. Yeah. And many people who are succumbing to coronavirus, of course, age is probably the biggest risk factor, partly because the immune system does become less robust with age. Yeah. But if you've got underlying poor metabolic health, it's even worse. And that will not be picked up by BMI in terms of obesity. It's going to be picked up by your metabolic health. And
you're absolutely right, Dr. Malhotra. When you say about ethnic background, we now it's a time to put the preventive measure, especially in the light of scare of second wave, which government as well as many authority figures are suggesting that there could be a second wave of the pandemic which is coming. So, and as little as 21 days, which you are suggesting, if we can take a proactive measure to control our metabolic health, that could be a wonderful drug in itself.
Absolutely, absolutely. It's the beginning of that journey, to be honest, Pranita. So the 21 days, there were three real reasons why 21 days. One is that it takes sometimes, 21 days often is the time it takes to break a habit. So one of the first recommendations I do is for people to cut out the ultra processed foods and sugar from their diet and low quality carbs, which, for many people is a form of addiction, and once you cut it out, then the cravings disappear. The second reason is that there's metabolic health markers improve significantly. And metabolic syndrome, which is a worse manifestation of poor metabolic health, which is basically having 3 of those 5 markers we describe being the abnormal range, is associated with the highest risk of death from COVID-19, more than obesity, more than type 2 diabetes alone, more than heart disease alone, more than blood pressure alone. It's about 3.5 times risk of death and about 5 times more likely to be hospitalized with COVID. So that is clearly the issue. Now, the reason I mentioned that is within 21 days, you can reverse metabolic syndrome. Certain clinical studies have shown that can happen in up to 50% of patients within that 21-day period. And many of the others will improve their markers. So you can come out of metabolic syndrome. So that's one of the other. And the final reason is just to change the narrative related to that is that, those dietary and lifestyle changes can have a rapid effect on your health markers very quickly. And it's about making sure that this can start, for individuals, but also that GPs can prescribe this to patients very specifically. And today in the news, as you probably heard, there's been a big awareness campaign trying to push out and roll out low-calorie, ultra-processed shakes and soup. So people who have type 2 diabetes, they follow this plan, which is 800 calories a day for 3 months. which is quite harsh, I think, and and quite difficult for many people to sustain. But clinical trial, randomized controlled trials showed that up to 47% of people had remission of type 2 diabetes in 1 year. However, this is a very select group of people. Less than 1 in 3 people can manage to sustain this for more than a few days. And then we're reporting on the 46% of people who were able to go on this plan. And the other thing is that they weren't given an alternative of going on a real food diet without restricting calories. So I think this is all about also giving people all the information so they can make an informed decision. And of course, if they follow a real food diet plan, and that doesn't help enough, or they're struggling, then of course we can use these kind of ultra processed, whatever. If they need those extra help and going ultra low calorie, then of course that's an option, but it shouldn't be first line. It's not going to be economical. It's not going to have the impact that it should have. And it's also about the culture. It's about changing the mindset away from having these sort of artificial foodstuffs to eating real food, because the real problem behind the obesity epidemic and type 2 diabetes epidemics across the world is the last few decades, we have now got this predominance of these sorts of packaged foods, which increase appetite, that are going to increase glucose and insulin, which is going to lead to insulin resistance and excess body fat, and affect hormones that control what we eat and how much we eat. So this is where the change should really happen on a grand mass scale, and will have a much bigger impact on many more people this way. I have no doubt about it.
Yeah, and I absolutely agree, Dr. Malhotra, because this kind of diet and shake, they work for certain period of time, in perhaps for the 3-month period, perhaps for the 6 month, even up to 1 year, until that diet is adhered to. But it's not sustainable lifestyle, A, and plus B, the additives. There is a great book called from Vani Hari, that she actually opens up so many additives which are the hidden ingredients of these diet shakes. And
Pranita, I think one other thing that needs to be mentioned that's being missed, the elephant in the room, is it's a very, I don't think it's deliberate, but it's a very racially biased study. There was hardly anybody from an ethnic minority background, as far as I'm aware, enrolled. And the people's BMI, almost everybody was obese. Now, most people with type 2 diabetes are not obese. Let me repeat that. Most people with type 2 diabetes are not obese. They're either overweight or have a normal BMI. And one of the part of this plan is this massive weight loss, even suggesting you need to lose more than 10 to 20 kilograms to really send into remission. Now, that is not going to be a feasible approach for people with who have a normal BMI, so-called normal BMI type 2 diabetes. And the other thing to mention is that when you go in this sort of cut out the ultra-processed food, the sugar, the low-quality carbohydrates, the effects on metabolic syndrome from clinical studies show this independent of weight loss. So you do not need to lose weight necessarily to improve your health markers. Now, many people as a side effect are going to lose their excess body fat and weight, but it's not necessary. And of course, in my view, this is going to be much more feasible and better and efficacious in people who have type 2 diabetes, who are just overweight or have a normal BMI. So I think this is a really important message people need to understand. A lot of this data information, the mass media reporting on it, in my view, is extremely misleading, not deliberately so, but people aren't looking at the actual totality of the evidence, and they're not actually thinking about who's this appropriate for. And of course, it's also contraindicated in certain groups, such as the elderly as well. So I think we need to think about all these things.
And when you say that it could not be totally deliberately, what we know from the pharmaceutical company and the research backed by that, it may not be true.
Yeah, I think there's a financial interest certainly with this company that's that obviously wants to sell their shake products.
Yes.
But fine, these are profit-making businesses. But our job as doctors, healthcare practitioners, is our duty is to both patients and scientific integrity. And scientific integrity means being honest with the totality of the evidence and what it means in the real world in terms of how this can be implemented. So I think it's about giving patients options. And certainly in my experience, Pranita, I've not found a single patient that would choose to have this sort of approach first when the alternative is eating real food and not having to restrict calories. Almost everybody wants to go for the real food approach. So where's this discussion happening? And if patients are not given that option and doctors are not empowered with that knowledge, which is another problem, then to prescribe that for patients, and it's not going to be very effective. We need a real significant change in the culture of food, the food environment if we're really going to impact population health, rapidly. And this is really, for me, this is a primary approach. It's going to be a drop in the ocean in terms of impacting type 2 diabetes on a population level.
I think I totally agree. And from whatever you are saying, from many decades now, almost a decade, with your poppy diet, your clinical practice, both in NHS as well as abroad, international, and you're not immune to controversies of your views on statin. And now with, I'm sure with your newer book about many medics are firing you on immunity, your remarks on the immunity. But in a sense, what you are saying is the physiological response. Your body.
Oh yeah, Pranita, there's nothing that I've written in the book that isn't accurate and can't be backed up. People can have differing opinions of different approaches, but this is very clear. So, there has been a bit of, overall, the response has been overwhelmingly great. The book is a bestseller. The reviews have been fantastic. In the majority of cases, there are people who can disagree. There are many people who haven't read the book or are making opinions. So this is a problem. And unfortunately, a lot of this comes from healthcare practitioners. And it's multifactorial, rooted in, lack of knowledge. It's probably an element of guilt. There's probably some kind of bias there for whatever reason, including racial bias, unfortunately. So you don't have to take these in your stride. But, you said controversial. What I would reply to that is, in the time of universal deceit, telling the truth is a revolutionary and controversial act. So if being honest and truthful and trying to help patients is controversial, then please, I'll be as controversial as you like.
Yeah, and it's towards the end when you are taking Hippocratic oath for after your medical studies, you are working towards the best interest of the patient. And
I think we've lost that. That's the problem is that people aren't aware of this. We have, I've said this in many of my talks before, we have an epidemic of misinformed doctors and misinformed and unwittingly harmed patients. Until this is sorted out at the root, which ultimately means getting commercial influence out of medical science and medical guidelines and research, until that disappears, then this problem will carry on. We're not going to really sort population health out. And we're not going to be able to really adhere to the true principles of evidence-based medicine. So that's something I campaign on and I'm advocate for. But one of the reasons, Pranita, and I have no doubt the overwhelming majority of doctors go into the career because they genuinely want to do good, they want to help their patients, but most of them are not aware of these system failures. So until they become aware of it, until everybody becomes aware of it, including patients as well, we're not going to be able to change the system.
And also to tell you, extend your opinion that when we study into the medical practice or medical studies, we spend about like 5.5 years in the studies and then going into the practice. And it's been 10 decades of information, the same in and out. But now I think we have to grow our horizon, be open to the new changes happening rather than being stuck in the past.
Yeah, the conventional medical model, I think, needs to change. Absolutely. We need to adapt and, to a changing, environment in terms of the type of people and the kind of sicknesses they have. Most of the chronic disease is being driven by lifestyle, illnesses. And therefore, to combat that, we're going to have to, get to the root causes of it. And unfortunately, modern medicine, for all the great things it's achieved, especially in acute care, it's not done very well in managing these chronic diseases. And the benefits of many of these drugs are marginal at best, and they come with side effects. So it's not about completely denouncing the use of medication, but for the chronic disease, it really should be there as a backup with informed decision-making, so patients are empowered and they know exactly what they're getting from the pill, but also giving them the tools and empowering them, supporting them to really improve their lifestyles, not just in terms of longevity, but about their quality of life too.
That's where you hit the point, quality. And I think I agree that in the medical profession, we always look for lengthening lifespan. But what's the use? I believe what's the use of person staying in the stroke unit and we are lengthening his life by day-to-day basis. But instead of that, we need to think about how we can take a proactive, preventive approach, and whatever life years he has, to add the quality to his life. And the
Yeah,
quality,
yeah.
yeah,
A doctor's role is not just about delaying death. In fact, a more important role, most of what we do is, in literal terms, palliation. It's about relieving people's suffering. And that can happen from conversations, from reassurance. But in this instance as well, it's about, as you say correctly, it's about the quality of people's lives. And I think we need to think about that a little bit more. You can't, in general, people's quality of life does not improve from these pills, for chronic disease management. And if you get unlucky enough to get side effects, it's only going to make your quality of life worse. Alternatively, there's no absolutes, but in general, lifestyle changes improve quality of life and come without side effects. So I think there needs to be, that discussion needs to be, repeated, and we need to have more awareness, and we need to, as a medical profession, we need to think about that a little bit more. But of course, yes, as you say, we've got this conventional medical way of treating symptoms with drugs as opposed to getting to the root cause. And the real world evidence tells us it's not been very effective. We've got this big problem. If we were doing everything in the right way, with all the information, I don't think we'd be in the state that we're in at the moment, with huge stress on the healthcare system. And of course, COVID has just exploited our dire baseline metabolic health. But it's time to do something about it. And I hope people can, get the book, make their own minds up, look at the information, empower them, speak to their GP. And I'll obviously be advocating, I'll be speaking to, doing many lectures and, over the next few months to general practitioners, to doctors. I've been invited for several, which is great, very positive move. But we need to get this inculcated into medical training and postgraduate training as well.
yeah. Fantastic. And I encourage everyone who is listening to this audio and video version of the interview, because Dr. Malhotra's book doesn't only talks about lifestyle in terms of diet, but you talk about the sleep, you talk about the stress management, you talk about the importance of forming community and building, strengthening those relationships. And that's where I don't think any medical profession talks so widely. And I think it's a great input for many people, or great insight for many people. And in relation to that, do you agree that common medical practices miss this information, miss the information about the habit changes, psychology, and dare I say, knowing about the culture and even spirituality?
Yeah, sure. I mean, this is a bigger, wider topic, but I think it's not something that's part of the routine discussions necessarily in medicine. And it's because of lack of knowledge, lack of confidence, and lack of time predominantly. Pranita. So, 80% of these, chronic diseases are related to lifestyle and the environment, the conditions in which people grow, live, and work. And a lot of psychological stress that adversely affects people biologically comes from also the environmental impact of low wages and poor housing and loneliness and, jobs that are not very satisfying, etc. So we have to think about that on a wider societal level as well. But that all comes down to mental health and psychological stress, doesn't it? So I think we need a bit of a wider conversation. Most of, as I highlight in the book, most of what determines your health happens well before you get into the hospital grounds.
Absolutely, absolutely. And your book not only talks about it, but actually gives you a plan, a step-by-step process to inspire people.
Yes, absolutely. The final chapter, I talk about, what policymakers can do, but also for the reader. We're supposed to be living in a democracy, or you can argue whether we actually have a true democracy when people are making decisions on bias and selected information. We haven't really got truly informed consent. So it's something we should all strive for. But I think it also, I give people, and I write in the book that I think if people agree and they see it makes sense to them, and they want to do something about it, we can all be advocates for this change for the community, because helping the community is also helping ourselves. We're all interdependent on each other, Pranita. The clothes we wear have been made by other people. The ingredients we use to make our food and cook even, so many other people are involved in that process. So we're all interconnected. And if we think about not just ourselves, but how we can have a role in helping the community, then we're only helping ourselves ultimately.
Absolutely. I mean, and that's where that interconnectedness, spirituality comes into the picture, because that relationships, the connectedness is real juice for our life. And that's where we can enhance not only our quality of life, but everyone else around us.
Yeah, and research shows that the single biggest determinant of happiness, we talk about happiness, and physical health and mental health, of course, are intertwined, is having meaningful, good quality relationships.
Absolutely agree, Dr. Malhotra. So how we can be accountable to each other? Like if a reader is reading your book, do you have any practical steps to be accountable to any other, maybe a family member, friend, so
Yeah,
that...
I just give them the book. I mean, tell them about it. Give them the book. Say that, you know, it's not a long read. It's 2 hours maximum. You take a read. I can assure you won't get bored. I think the information is packaged in such a way, and it's interesting, and it has a flow. You know, if you enjoy it, give it to your friends and family. Give it to your doctor. You know, this is a grassroots movement. It can spread very rapidly, and I think that's and people are looking for other solutions. And of course, you know, with your doctor, if you're in a condition where you've got poor metabolic health, you want to improve it, then, you know, your doctor can monitor things and you can have a discussion with them. And of course, you know, if you're type 2 diabetic, for example, or blood pressure pills, then those pills would need to be weaned off. So that needs to be done. It's really important with a discussion with your clinician or healthcare practitioner. That's a way to do it. And of course, when it comes to the population changes that are needed, whether it's you know, banning junk food advertising, ultra processed food, taxation, for example, getting, you know, the sale of junk food out of hospitals, which doesn't send the right message, then you know, take up your voice makes a difference. If you write to the chief executive of the hospital and saying, why are you selling ultra processed food on the premises? This isn't sending the right message. It's not good for patients and staff. They have to respond. Write to your MP, you know, empower them and say, what are you doing about this? I think, you know, I've you know, been in this campaign for many years. What I prescribe and what I advise is evidence-based. It's also about social justice. And you can do these things. This is what you can do. Everybody has a role to play. And don't think that you're insignificant. Everybody is significant in this. And if we all work together, then we have a huge grassroots movement for change. And I, of course, you know, are also working and trying to influence health policy. I've been in direct contact with the Secretary of State for Health and Social Care, Matt Hancock, who asked me to advise him on links between COVID-19 and obesity, after I was publicly the one, the doctor that highlighted that the likelihood why Boris Johnson, our Prime Minister, got sick was because of his weight. You know, so when you have this top-down change, which meets a grassroots movement in the middle, then you have a revolution, and that's exactly what we need right now. We need a health revolution.
We need
Thank you, Pranita.
Health revolution, exactly. And your book is going to inspire that revolution to begin with. I wish all the best for success of your book. And anyone who is listening, go to Amazon and get the book right now. And to encourage you to act on it, I'm going to be accountable to you. I'm going to be following from 1st of September till 21st of September, Dr. Malhotra's action plan, and wish you all the best for the success of this book.
Thank you, Pranita. Been a real pleasure speaking to you.
It has been mine as well. Have a good day.
Okay, bye-bye.